Hello. Hello, my name is Yahya and I have attempted the June session of FMGE exam, and I am here to share my strategy regarding the FMGE prep. And right now, I am live from PrepLadder, and my name is Dr. Yahya and I studied from Georgian American University, and I was a student. I just graduated in January, and that is when I started my preparation, and I studied for about from about my third year, and this is my take on the exam. And I'm here to help and offer any kind of answer any questions if somebody has any. I scored about 211 in the exam, and yeah, so let's start. So, what was my take on the exam? This recent 2026 exam was a bit controversial, and there were so many opinions on it. And in my opinion, the exam pattern it was a little bit difficult compared to the previous exams, and there were the new idea of MCQ questions, sorry, video questions, and those were some were easy, some were difficult, some I did not know at all, and it was there was a bit of a shocking factor in the exam, and that is why it gets a little bit tricky. So it was extremely clinical, and it was a lot of integration was there, and we'll discuss how integration and clinical things work differently. And based on concept based approach, what I would like to discuss is let's take an example of heart failure. For example, heart failure in basic terms to us is a reduce in cardiac output, but just this was never enough. Even before this type of exam was conducted, you had to know the neurohormonal regulation, you had to know what are the symptoms, the forward symptoms, the backward symptoms, like that, and you have to know the core concept of the subject. Without the knowledge of the core concept, there is no attempt to the exam. You will always fail, even if you give GTs at home. Without the concept, there is nothing that comes out of it. There is absolute necessity of concepts here, and all the platforms, including PrepLadder, they offer extremely great concept based approach. You have the best faculty in the game, and you will always have teachers at your disposal who are ready to explain the concept. But the problem is this thing takes time. The keeping the expectation that when you read it for the first time, and on the first approach you're going to understand things, you have to know कि ये जो subject है, these are interconnected with each other, right? Like medicine is so much reliant on pharmacology. Medicine is so much reliant on pathology. Surgery is so much reliant on anatomy. Radiology is so much reliant on anatomy, those knowledges. So you have to get into the detail. Now, yes, I will explain it for how do you approach it for the JAN exam. But before that, understand how you approach the subjects, right? So, understanding for the subjects, you have to know that how anatomy will influence your physiology knowledge and how physiology will integrate with pathology and pharmacology. If you understand this, you know the concept, right? You begin with one of the subjects and you go ahead with in the same direction. I have discussed all of it further, and you have to know clinical integration. Let's take up heart failure itself. We will take heart failure ahead. Like how do you integrate clinically? If your patient comes with heart failure, you know there are four chambers and XYZ and XYZ. But you have to understand how diastolic failures differs from systolic failure. Why we say diastolic failure mostly is related to the right side, whereas systolic is to the left side. Like it is not like absolutely like that, but you have to understand for The exam, you have to generate an approach. You cannot just mug up everything. It does not work like that. You have to know things. You have to be able to build things on the questions. You have to learn to pick up the buzzwords. In clinical integration questions, you get questions on anatomy, which are a result of injuries, right? For example, limb injuries, in some kind of limb fractures, in shoulder dislocations, in the fractures of the radius and ulna. You have different kind of presentation. You have to understand that in the latest format, the videos will show you those clinical scenarios, hand drop, foot drop. You have to understand how do you differentiate the early part or the proximal system injuries to the distal system injuries. That is clinical integration. Or this time in the exam there was a question on the tearing. So you had the test for tearing. You just don't have to understand ki, in theory concepts, yes, this test looks like this. No, you have to understand how the test works, why it works like that. So that is clinical integration for me. And moving further, what was the biggest issue for me was PYQ recall. I was, for the longest time, I was not able to understand how do you source, like how do you source a PYQ? Where do you start sourcing the PYQs from? Who to trust? But I think 3 months into the preparation, I understood that you have to take PYQs with a bit of pinch of salt. Okay, anytime when I'll explain you why a pinch of salt. When I came back from the exam in the evening, there was so much chaos regarding the PYQs, the recall. Everybody was saying different things, and in the end, a week or 10 days later, PrepLadder uploaded the questions and they curate it very specifically. They polish it, they change the language to how the exam language should be. I have attached a few questions further and we'll discuss it. But sourcing the PYQs, you cannot trust the exact language of the question. That is impossible. The only person that knows the question is the student that has attended. And for example, I attended the question. Doesn't matter if I got it wrong or right. It only matters that what I understood and took from the question, right? In gynecology, the questions are a bit lengthier. So it is the crux that you take out of the question. You come and tell it to the teacher or the faculty, and they create the question and ask you, is it close to the question? So just take the crux. You have to understand, when you solve a PYQ, all you need is what is being asked. You should not care so much about the language. It doesn't matter. You can't replicate it. It is person to person how they take it out, right? And where to find reliable PYQs, you can absolutely join PrepLadder for that. They have a separate section for PYQs. But while you solve PYQs, all you have to do is you have to keep a track record of your PYTs. What was the topic that was being tested? Because those topics are going to be tested again. They have a certain set of topics that you should know, and that is what that they are testing. And how do you solve them? When you solve them, you approach the question. I prefer to solve them not in a test format. I solve the question, I read the explanation then and there to fit it in my system. The only tests that I take in the exam format are grand tests. We will discuss that as well. But PYQs and customs are the two things I prefer to solve in, like reading the explanation just after, right? I don't test myself with the PYQs. I try to understand the PYQs, and I collect the PYTs. I collected those PYTs. I have books of like topics and topics of just. I sat down and I ran the questions from last year to previous 3 years, 5 years, depending on the subjects, and I collected those topics. I kept the list, and when I study those, when I am revising those are the lists that I follow. That is what you should follow. Your first reading drags out everything. You take everything into consideration, but you have to cut it down. You have to realize that you are not preparing for that one day. You are preparing for the last 10, 15, 20 days. What you have to do in those 20 days will depend on what you do in the past 5, 6, 7 months, right? So what should be your approach? That is while what you should think while attempting the PYTs is, if this is the question, what was the topic that was being asked? Let's say previously, let's continue with heart failure. If heart failure was being asked, what in heart failures do they prefer? If do they want the management in the last 5 years, do they prefer the management more? Do they prefer the symptoms more? Do they want to discuss what the patient will come with, or how you manage in the long term, the acute decompensation? What is the favorite part? And in and around those, okay, that is what is the best thing about it. Like, you can actually collect it from the question banks, right? All prep ladders have question banks for all subjects, even integrated subjects. Prep ladder also has a section for integrated medicine and integrated study, right? For the new pattern, when I approach the video questions, first of all, you have to understand the ask of saying that the pattern will not change is very wrong. You cannot expect that the pattern will stay the same forever. It will not. There will be changes. But when you study from a video platform, let's say, for example, PrepLadder, they are showing you videos. If you ever go into ophthalmology, the doctor has showed his own patients. Like, even in LRR discussions, he has shown his own patients. Okay, he has discussed test. He has shown performing the test. So those are exactly the videos. If you are expecting that you have a question bank of videos that is like is going to be generated now, they will generate it. But when they teach it in the video lectures, they are actually doing that exact thing. Most teachers try and show you the test on themselves. They walk clinical test, the mobility test, they show it on themselves. They show the patients. So you are not under prepared for it. The only thing that was difficult for me, the factor of surprise, that I never solved these questions. But okay, there was a question on Korea this time. So you know it. They will show it in the video lectures. You already know it, right? So it's not difficult to solve the video questions. Absolutely easy. Those are the basic questions. The current style of questions is very, very integrated. I will show you how to integrate. This is exactly the slide for integration. I'll show you how you integrate the questions. Okay. Now, what you need to understand is how to start the subjects. So I started with embryology because I'm a very organized person. I like to go in the flow. I started with embryology and histology to understand the basic concept of how life begins, and that was my approach. I started with embryology. So when you start with embryology, you have to sit down first. You have to source any kind of rapid revisions, like PrepLadder has a series for rapids. PrepLadder has LRRs, right? You have to find the topics. Okay, embryology, what you need. Let's say, for example, embryology, you need the formation of zygote, that is fertilization. You need implantation. You need the first few weeks. You need folding. So you have to previously know, kind of. You are not new to the subject. You have done the med school, right? You know what the topics are in embryology. You know what embryology is. You have to list it down, that I have to know these things from rapids. Or you don't have to understand the rapid revision just yet, the RR series. You have to just understand what to take away from it, right? You list it down, you go to the main videos, you finish the main videos as fast as you can. Those topics that have been covered, you pair it, you keep it in your head, you move on to the next subject, right? When you complete the whole subject, you will understand the implication of understanding those lists, right? So then I moved on to histology. But histology, in my opinion, for the take of the exam, is there are certain topics in histology, that's all you need. But to understand those topics, you have to understand histology, how histologies work, how you take how you approach the question for histology. When you think this is this, this is that, that is it. Okay, then I moved to obs then, because I did not know where to go from there. But that was also a very good decision for me. In obstetrics, when implantation is done and you move on to the obstetrics, it continues like a flow. It helps you understand why the fertilization happened in such a way that OBS takes decisions in such a way, right? And in OBS, you will also understand so much part of embryology. It also is kind of a revision for that part, right? Now, after OBS, I decided I have to split the subjects into two, right? Integrated subjects and individual subjects. I will first discuss about integrated subjects. You have to understand microbiology and pediatrics. They come in everywhere. Every single subjects have these things, right? And all the subjects, they have a part of microbiology to play. They have pediatrics has part of all these things, right? So before you begin the integrated subjects, you have to go for the general part, the general path. You have to study general pharma. You have to go for these things, right? General radio, you have to study these things. So these general part, the general pathology, general pharma, and general radio, these come in everywhere. All the subjects, they will carry these. In general pathology, you will learn about the stains, the procedures, how you take the sample, all of this will come in general, right? And after that, in general pharma, you will have system wise division. You will have a bit of how pharmacology works, the vigilance services, and those are all MCQs. Those are very important. People tend to skip those, but those are really important. Let's say we start with head and neck. Okay, when you're starting with head and neck, you read the anatomy. Okay, now you are freshly primed to understand about ENT and ophthalmology, because you know the structure, you know the anatomy, and ENT opthal is a short subject. It is easier to do it early and revise it later than to do it later and worry for revision. Right? ENT is an amazing subject. Ophthalmology faculty for PrepLadder is the best. You need ophthalmology and ENT for the scores. There are so many questions with ENT ophthalmology. Even this time, there were so many questions in ENT ophthalmology, and it was a very easy question. You were given like the instrument, and you had to identify it. So I'm not discussing the question straight up, because you need to understand, you took the question, you know it was an ophthalmometer. Now you have to understand the questions in ophthalmology are what. You have to take the instruments, you have to generate a list for yourself, you have to keep the pictures, you have to name the pictures, and just you have to revise it constantly. There is no other way to learn instruments, right? So once you are done head and neck anatomy, you go for ENT and you go for ophthalmology, and you're done and dusted with that system. Close it down, keep, and you have to concise the notes. Always remember, you need this in your preparation. You have to have a concised book of notes, or a concised, maybe if you're making digital notes, you have to have a place where you have concised subject within, in 5 pages, 10 pages, 20 pages for short subject, and maximum 50-60 pages for the large subject, like the large systems, right? You have to finish it off in the smallest way possible. You cannot go and revise the main videos as a whole thing. You have to carry on, and you have to generate the idea that you have to shift from theory to MCQ as soon as possible, by the way. MCQ is also a form of revision. When you read the explanations, you reread, and you have to keep the pictures of those. Everybody has digital things right now, okay? We all have phones. Generate an album, keep an album with yourself. You have to keep the explanation of MCQs. You have to bookmark the MCQs. You have to keep photos of those MCQs with yourself, so you can read those in the end. I have made all of these. I still have those. I have group with myself. I am the second member of the group. I have over 150 pictures of MCQ explanations, of quick explanations, where they explain you in the shortest way possible. Everything that is large, you have to convert it into a shortest form for yourself. You are making all the prep for the last 20 to 30 days. Okay, you have to read everything then. You have to revise it quickly, and you have to go to MCQs, right? Now, let's say you finished ENT, opthal, and head and neck anatomy. What to do now? Start doing customs. Okay, start doing customs as soon as possible. You have to generate a custom. You have to integrate these subjects. Select these 3 subjects: ENT, ophthalmology, and head and neck anatomy. All anatomy, physiology, whatever, all the subjects that it has. Okay, go generate a custom module and solve and read the explanations. I wasted so much time just solving customs and never reading reviews. That was a blunder by me. If I could have I could have clicked more pictures of those explanations and just read the explanations over and over again. You revise the whole topic. The explanation is not just about the question. They explain the topic under the question, right? So you have to read it. You have to have explanations, and a method to quickly go back to those things. Photos are the best way to do it, right? You maintain an album for yourself or a short written note or post-its. You do it. And you have to have generated such things. Let's say you move on to neurology next. Now, this is a complete subject, right? Head and neck, you have just freshly read head and neck anatomy. You know the skull, you know the foramens, you know the how the parts, how the nervous system, how the nerves for ENT and opthal work. Now you have to understand the source of those nerves. So you go to neuro. You read neuroanat, you read neurophysio. How neuroanat will help you in neurophysiology is literally the first time you will understand how integration works. Okay, then you read neurophysiology. Neuropharma is the best to understand after physio. So you can read patho, or you can read pharma, or you can read both. Okay, you can read either of them first or both simultaneously. You will understand how patho pharma depend on anat and physio. You need it because pathology, so many things in neuro are anatomically, visually possible, and in imaging. So this anatomy will help you with radiology here. Okay, and when you read patho and pharma, close by, you know the interdependency of subjects, and all of these four will generate the understanding for the big boy, that is medicine and surgery, right? So medicine is extremely important for people, for the exam. That is kind medicine is kind of the revision for all of these 4 5 subjects. You need this is very important to have a basic understanding of the subjects, right? You need all of these four to generate an idea of medicine and surgery, and anatomy will help you with the radiology, and patho and medicine will help you with the abnormal images in radiology and surgery as well. So that is an integrated approach. Now, if this is very superficial, I'll get into it with you. So I have already, this PPT will be uploaded on PrepLadder's channel, and you can get the screenshot of this system-wise approach. And the individual subjects like derma, all of these are used to boost your score, right? Derma, limb anatomy and orthopedics. You'll notice I did not add limb and vertebrae here. So limb, vertebrae, these are integrated with orthopedics, so you can quickly move on to understand the pathologies. You are not a fresh student, right? You know what orthopedics is. You have to understand what is in the subject. So go, you can read limb anatomy, vertebrae, and go for orthopedics. You can read biochemistry. Biochemistry, in my opinion, is a very volatile subject. You have to, you can read the subject very quickly, and you have to generate a note, or you have to mark it in your notes from PrepLadder if you get any, and if you buy the notes, and you have to annotate and keep how you are going to quickly revise the subject. The whole biochemistry is divided very simply. You have carbs, fats, and proteins, vitamins, and other micronutrients, and deficiencies. Always ask a question on they always ask a question on microdeficiencies, right? There is that is a guaranteed question. But the only risk to reward is there are too many things to study. But it's okay. That is one question. You don't want to be the 149, right? So then there is FMT. It is we had, I think, about 3 to 5 questions in FMT without integration. And there is anesthesia. Psychiatry is a very scoring subject. The only difficult part about psychiatry are the drugs. So if you can try and read it early on and revise very much, you will gain the taste for those new drugs, and you will start to identify the symptoms and side effects of those drugs very quickly. Okay, PSM is the gold mine. PSM and OBS-GYN are the gold mine. They make so many questions, they generate the bulk of your passing, and PSM is a very easy subject. And PSM is very lovely to study. It is a light subject. You have to understand it once and it stays with you. You just have to keep on updating yourself with the recent guidelines. That is it. And they upload, you get the stories, you get the videos. Everything is available on the app, and you kind of like always have it on your fingertips. And it also integrates with all the subjects. Like PSM will give you the guidelines for the management of malaria, TB. Those are the up and running things that are going on in our country, and we need those. The recent AIDS management, the management of there was a scheme called 666 that was for anemia Mukt Bharat, and that is updated right now. So it is one of the most important subjects, most important topics in PSM, and there is a very high chance that it will be asked in the upcoming January exam. like it is one of the most important topics in PSM. It integrates with so many subjects, and it has an update this time. So there is a guarantee that that will be asked, or this one or the next one, right? They will give you time to prep it and they'll ask it. And infections, you have to carry on infections for your life. Keep a separate book for infections, TB, pneumonia, the mycetoma of foot. All of these are very common in our setting in India, and those are going to be asked. You have to understand the exam is tested for India. Those the topics that are going to be asked will be from majority of the diseases going in running in India. So that is how the paper is set. Now I will try and explain to you how to do integration. Let's say we go for respiratory system, right? So understanding integration for respiratory system. This is a complete core example of how I integrated respiratory system. Okay, so the order to for me was anatomy, physio that I explained earlier, patho, pharma, medicine, surgery, and all. But I was from the beginning of time. I always was a fan of systems. I loved doing it in system, like doing the whole respiratory system. I never did thorax anatomy, abdomen anatomy in a flow, and then moved on to physiology. No, I started like this. I was always interested in the subject because I was very curious. So I started in the system. So I'll show you, and you have to connect the concepts. The concepts will connect automatically. They are like when you study physiology after anatomy, you will understand that why there was a division of the segments in the lung, and now how the capacities change because of those segments, right? So moving on. Uh, let's say you are integrating anatomy here, right? So while integrating anatomy, you have to first list out the topics that I said. You can. My approach was first go for the short form revision videos like LRRs, and collect the system. You collect the bullet points, what you want from the system. Like let's say for in anatomy, you need the constrictions, impressions, arrangement of the hilum, the hilar arrangement, the pleural segments, vascular supply, lymphatic drainage. This, to me, I think is one of the most overseen topics. People tend to ignore it, but it is one of the most important topics for oncology, right? You will always need it for oncology because they will always ask, where is the cancer going to go? What is the sentinel lymph node? So here you need lymphatic drainage. There are not very core questions on lymphatic drainage for majority systems, but the idea that it will go from the cancer will either transmit from this to this area, or why it ascends or why it goes retrograde is all because of lymphatics majorly. And the vascular supply is also very important. Like this time we had a question that was straight up, it was straight anatomy question. Where does the vein of Mayo drain? Right? When you study GI anatomy, you will learn about the vein of Mayo. And where does the vein of Mayo drain into? It was a straight one-liner question, straight 1 point. Right? So this is my own personal notes, and I have concised my notes in such a way that I only have to look at it once and I can revise the subject. Right? These are impressions, and this is hilum. Okay, so this is impressions and this is hilum, and you there are absolutely always in the alternate exams or consecutive exams there is one question about this. These impressions are so important. Uh, Even in surgery, even in medicine, you will require the impressions. They will teach you in all the subjects. It is so important, right? Constriction was a controversial topic beforehand, but there is a lecture of Dr. Azam in PrepLadder. He will show you the screenshot of the book. He has posted it on his story that the controversy is dissolved. I'll keep it. I'll not disclose what the controversy was, but there was a controversy between surgery and anatomy, and Gray's Anatomy latest edition. It was sorted off, and he has a separate section on his Instagram about all the recent updates on the books. So please follow him. He is one of the best teachers for anatomy. He explains it so well, and his LRRs are absolutely gold. In the last 10 days, when I was in a bit of too much pressure. The LRRs were amazing. Okay, so I'll discuss about how to use LRRs. So go to LRRs or go to any kind of rapid revision videos in the PrepLadder. In PrepLadder, you will find it. Go and figure out the subjects. Once you figure out the subjects, once you figure out the subtopics, bullet it down. Let's say in respiratory anatomy, these are the topics. There are more. This is just an example. So you take it out, and in your concise notes, you need this, right? In the concise notes, these topics should be at least there. In the shortest 2 line, 3 lines, this is the whole pleura, these are the impressions, this is hilum, these are bronchopulmonary segments, right? Moving on. Let's say we finished anatomy. Go and do your customs. Solve the custom module for anatomy of respiratory system. Okay, like once you solve customs, you will know what is important, what is not, what you have to remember, what you didn't know, what you knew already. It is a complete thing, the customs. And I will also explain you further how you should use the hashtags for customs, right? So let's say you finished anatomy, you did your customs, now you come to physiology. Physiology in respiratory is one of the most important things. Respiratory physiology is always asked. We had graphs this time also. We had graphs in the past. There is always graphs. So let's say in respiratory physiology, you find these topics. You went to the revision, any kind of revision videos. You found the topics, and now you are going to concise these. Can you see how concise these notes are? These are my personal notes. Volume and capacity is in 4 to 5 lines. You need ventilation perfusion in 4 to 5 lines. There is no exam that goes off without the graph. You will only understand graphs when you understand physiology of the system, right? You need ventilation perfusion, the mismatching, matching, how it goes off from above to below. You need all of this in respiratory medicine. It is extremely important. The physiology, these are the high yield areas. You need a note for these. So when you start the subject, the first page should be the list of topics that are important. Then you move on to the main videos. You have to concise the videos in the end. You watch the video, whatever you scribbling you did, whatever you underlined in your notes, your personal notes, or the books from PrepLadder. Now just list it down in your own personal book in the shortest way possible. Okay. Now, moving on, let's say you finished physiology. What to do next? Now you have to give a custom of anatomy and physiology. This is very important. Once you start giving custom in the integrated format, you are already preparing for the GT, right? Once you are able to solve anatomy and physiology customs together, you know how the subjects integrate together. Now, let's say now you moved on to pathology. When you know physiology, then only is the way you understand pathology. Or when you know anatomy, if there is an anatomical pathology, you will understand pathology. So let's say you were reading respiratory system, you moved on to abdomen. Now the part in pathology is missed. There are certain topics that are in continuum. You have to understand the continuum of things. There will be topics that are missed. You will find them here and there. You are going to cover it all. Once you are focused, you are locked in, you will finish it. All the topics will be covered in the videos, but the continuity of the subject should be there, right? That will help you in understanding the questions better. Most of the question in the exams were integrated. I'll say about 80% of the paper were integrated. They start with the subject. Let's say they started with anatomy, they finished on surgery, or they finished on medicine. They said this was an anatomical problem, so the patient presented with this, that is symptomatism. Then the patient underwent this procedure, and now what would be the complication? You see how it started with anatomy, it ended on surgical complication. Okay, so once you start pathology, you have to keep images in mind, because most questions are image based in pathology. But the pathological part is it integrates with the subject. If it is not pure pathology, it will be the support for medicine. It is the building block of medicine, pathology and pharmacology, right? So let's say I was studying respiratory system, and now I am understanding asthma. Okay, so bronchial asthma. What is the takeaway from bronchial asthma in pathology? That is all you need there. The images of the spirals and crystals, the biopsy findings, and who causes it. Right now, asthma is such a common topic. You will personally in your life know somebody who has asthma, right? So it is going to be asked somewhere or the other, some way or less. The asthma management updates should always be there with you, how the recent updates have changed. You have to know what drug plays a role in acute exacerbation, what is the drug that is used in the long term management. You should be able to answer these things at any given point of time. That will generate the ability to solve MCQs without reading. You have to read the whole question, but you don't have to understand the whole question. You just have to take out the crux and answer it. A stomach question can be either the management in long term or in the exacerbation, right? So go to the revision part, generate a list of the important topics, go and concise those topics in your personal book after you have watched the main videos, right? Once you finish the main videos, you need to have this page in your book. This is the concise version of obstructive diseases, right? Let's see it here. These are obstructive diseases. The obstructive diseases that you need should always be there. This is the normal histology. I have mentioned it because I already studied it in the previous anatomy with the embryology part. So I will go there, I will concise it here, and then I will study the obstructive diseases like emphysema, chronic bronchitis, bronchial asthma, etc., etc. Now, once you are done this, you have prepared a foundation for medicine, right? Now, you move on. I have not added pharma here because those are most of the respiratory things are covered in medicine, right? You have Dr. Deepak Marwa. He is one of the most amazing faculties for medicine to ever walk on earth, obviously. But he is amazing. He will explain you in a way that you will never forget it, right? So, now, here I will show you how to integrate radiology with the previous part. Let's say you started the radiology studying today. So, how do you study radiology? Before you study radiological pathologies, you have to understand the idea of how lungs looks on a normal radiology in various modalities. In all modalities, unless and until you don't know the modalities, what modalities are possible for respiratory system, what modalities are done in which condition when you don't need a modality. In or pulmonary embolism on X-ray. But are you going to really do an X-ray in pulmonary embolism? Is the question, right? So how this works is you have to first understand the normal radiology, then you move on to pathological radiologies. You should be at least in radiology, you have to understand, you have to know every single subject, every single system रेडियोलॉजी का. हर एक सिस्टम रेडियोलॉजी का पता होना चाहिए, नॉर्मली कैसे दिखते हैं और कितने वेरिएंट्स है. लाइक do we do MRI in this condition? If we do, yes, then how does the normal MRI look? That is the stepping stone. Once you know that, then you move on to finding the various conditions. Then you just associate. When you're reading pathology, when you're revising that, you will read, let's say you were reading asthma there. So asthma की इतनी तो imaging तो है नहीं. Let's say pneumonia पढ़ रहे थे तुम. So pneumonia, once you read pneumonia from pathology, यू विल अंडरस्टैंड के निमोनिया. आगे आओगे रेडियोलॉजी में तो मिल जाएगा ना कि निमोनिया कैसे दिखता है, और प्रीवियस ईयर्स के वो तो अभी आगे हम करेंगे कस्टम्स में कैसे करना है, बट तुमको दिख जाएगा कि निमोनिया की इमेजिंग कितनी बार आई है. लेट से ये क्लेप्सियला की वजह से निमोनिया हुआ है, यहाँ पे यू हैव एन इमेज ऑफ लीजियोनेला. सो दीज आर जस्ट क्लिनिकल सिनेरियोज. ये एग्जैक्टली ऐसा नहीं है, बट ये इमेज तुमको एड करेगी डायग्नोसिस तक जाने के लिए. सही है. शिलुएट का जो एप्लीकेशन है ये तुम्हारे को रेडियोलॉजी में दे विल टीच यू हाउ द शिलुएट चेंजेस you will see on the silhouette of the cardiac system and the respiratory system in thorax. ओके, तो हाई यील्ड एरिया क्या है इसमें? फर्स्ट नॉर्मल पढ़ो, नॉर्मल पढ़ लिए तब ही अब नॉर्मल समझ आएगा. ओके, तो इसकी जो जनरल होती है ना रेडियोलॉजी की, जनरल रेडियोलॉजी में ये होता है कि तुम एक्सरे में क्या यूज करते हो, एमआरआई में क्या यूज होता है, 1 से 2 क्वेश्चन इसके होते ही हैं, मे बी इवन मोर, बट मिनिमम 1 से 2 क्वेश्चन होता है. इस साल भी एक क्वेश्चन आया था, इस जुलाई वाले अटेम्प्ट में पेट सीटी के ऊपर क्वेश्चन था कि ये कौन सी इमेजिंग यूज हुई है, राइट? तो तुम लोगों को रियलाइज होगा जब तुम पढ़ोगे कि पेट इज सो इम्पोर्टेंट, राइट? PET is used for the metastasis. PET is used for understanding how the cancer travels in the body, right? Now, after you are done radiology, then comes the big guy, that is medicine. Everybody is scared of medicine. I love medicine. And you have to understand, you have to create a template for medicine for a system. For every system, you have to have a template. Because when you are right, when you are studying medicine, you have to understand कि एक system जो है ना, उनकी एक specific template होती है. जैसे कि रेस्पिरेटरी में इट इज बेटर टू अंडरस्टैंड ऑन कार्डियो. जब तुम कार्डियो पढ़ते हो ना, तो कार्डियो में मेडिसिन की टेम्पलेट क्या होती है मालूम है? S1 S2 कैसे चेंज होता है, मरमर आती है या नहीं, क्लिक्स आते हैं या नहीं, पल्स कैसे चेंज होती है, जेबीपी कैसे चेंज होता है, ईसीजी कैसे चेंज होता है, एंड पेशेंट के एक्चुअल सिम्टम क्या होते हैं, प्रेजेंटिंग सिम्टम्स क्या होते हैं. दिस इज इट. ओके, सो ऐसे एक जनरेशन करना पड़ेगा तुमको टेम्पलेट का. लेट्स से कि हम मेडिसिन पढ़ रहे थे ब्रोंकियल अस्थमा का. तो ब्रोंकियल अस्थमा में तुम्हारे को क्या क्या पता होना चाहिए? ब्रोंकियल अस्थमा में सबसे पहले तो ब्रोंकियल अस्थमा दो चीजों में डिवाइड होता है, एक्सर्सरबेशन और एक होता है क्रोनिक. जब वो क्रोनिक हो जाता है, सही, तो अगर वो क्रोनिक है तो हम उसको मैनेजमेंट क्या देंगे? अगर वो एक्सर्सरबेशन है तो हम उसको फौरन अभी के अभी रिसेंटली एट नाउ हम लोग उसको क्या ट्रीटमेंट देंगे? ये होता है उसका डिवीजन इन जनरल. ये तुमने ऊपर पढ़ लिया पैथोलॉजी में. नाउ यू हैव टू अंडरस्टैंड कि एक्चुअली जब पेशेंट आया से लेके पेशेंट घर जाने के बाद हमको क्या करना है, राइट? सो ब्रोंकियल अस्थमा में हमारा तुम्हारे को सबसे फर्स्ट क्वेश्चन, ब्रोंकियल अस्थमा क्या होता है, व्हाट इट इज, हाउ डज इट प्रेजेंट, व्हाट टू डू, राइट? एज कौन है, कौन अफेक्ट होगा? तो ये प्योर एयरवे डिजीज है. व्हाट डज इट मीन, व्हाट डज इट मीन ये प्योर एयरवे डिजीज है? इसका मतलब है कि ये डीपर सिस्टम्स में नहीं जा रहा है, राइट? एयरवे कोलैप्स हो रहे हैं तुम्हारे, राइट? तो जो तो तुम पढ़ोगे जब तुमको आ जाएगा ये, तो इट इज नॉट अ क्लास फॉर दिस, वी डोंट वांट टू वेस्ट टाइम ऑन दैट. बट तुमको ये समझना पड़ेगा कि इसमें पैरेंट कायमा इन्वॉल्व नहीं होता है. तो अगर ऐसा क्वेश्चन है जो दे रहा है, जो बोल रहा है कि किसी पेशेंट का पैरेंट कायमा इन्वॉल्व है, तो यू हैव टू नो कि अस्थमा नहीं है, दैट इज रूलिंग आउट. हम सारे बोलते हैं कि रूलिंग आउट से क्वेश्चन सॉल्व होता है, रूलिंग आउट से क्वेश्चन सॉल्व होता है, बट हाउ आर यू गोइंग टू रूल आउट? इज दिस, तुमको उसकी आइडिया होनी चाहिए. जो छोटे छोटे पॉइंट्स होते हैं, दीज विल हेल्प यू, राइट? तो तुम्हारे को वो चीज की इटियोलॉजी पता होनी चाहिए, उसके फेजेस क्या है. फिर ये फेजेस बहुत इंपॉर्टेंट है, बिकॉज हर चीज के स्पेसिफिक्स इंपॉर्टेंट नहीं होते, बट अस्थमा विच इज सो 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 वेरी कॉमन, उसका सब कुछ पता होना चाहिए. एवरी सिंगल थिंग तुमको पता होनी चाहिए कि अर्ली फेज में कौन आता है, कौन से रिएक्टेंट्स क्या करते हैं, कौन से फैक्टर्स रोल प्ले करते हैं, कौन इंक्रीज करते हैं अस्थमा को, कौन डिक्रीज करते हैं, उसकी हाइजीन की थियरी क्या है, कौन से इंटरल्यूकिन रोल प्ले करते हैं, सब कुछ पता होना चाहिए. कौन सा जीन इन्वॉल्व है, टू एवरी सिंगल थिंग. बट ये सब कुछ तुमको है ना एक पेज में लिखते आना चाहिए. You have to concise it. Otherwise, revision becomes impossible. ये लर्निंग जो थी, इट वॉज सो लेट, इट केम सो लेट टू मी कि मुझे रियलाइज हुआ कि कंसाइज नोट्स ही नहीं है मुझे मेरे पास. आई हैड टू मेक इट ऑन द वे. आई फिगर्ड इट आउट कि रैपिड्स ये होते हैं एंड रिविजन के जो वीडियोस है वो ये होते हैं, राइट? बट for me personally, it was better that I made my own notes. I have digital notes for every subject possible, and now I can edit my notes anytime. I figure something out, I solve something, I get something, I change it in my notes, and now my subjects are complete, and it feels amazing, and I can read anything and I can search anything in my own notes, right? So तुम अगर एक पे ला सकते हो एक पेज पे, then you know the topic, right? Once you know the topic, then you have to move on and you have to understand कि इसमें से जो मुझे पार्ट आता है, you have to cut it out and then you have to keep the part in your head कि ये मुझे आता है. जो तुमको नहीं आता है ना, aid this page with your MCQs. When you solve MCQs, अगर तुमको नहीं आया and you know कि अस्थमा का क्वेश्चन है, so go back to your page. अगर तुमने लिखे हो वेल एंड गुड, रीड इट. अगर तुम नहीं लिखे हो तो मेंशन इट. ऐसे तुम्हारी नोट्स कंप्लीट हो जाएगी. ऐसा नहीं है कि ये पेज मैंने एक दिन में बनाया हो. दिस इज लाइक मंथ्स एंड ओवर द मंथ्स बनाई है. लेट्स से कि ब्रोंकियल अस्थमा इधर शुरू हो रहा है, क्या नहीं है यहाँ पे, हिस्टोलॉजिकल चेंजेस है, ऊपर भी थे, राइट? और ये एक्सट्रिंसिक एंड इंट्रिंसिक जो अस्थमा के टाइप्स है, जिसमें एडल्ट में आता है, चाइल्ड में आता है, कौन सा सीवियर है, कौन सा नहीं सीवियर है, वो है. अस्थमा की डिवीजन हो गया, अस्थमा का मैनेजमेंट हो गया, हाउ यू हैव टू कंपेयर अस्थमा टू इम्पेंडिंग फेलियर आ गया तुम्हारे पास, हाउ यू डिफरेंशिएट इट, बिकॉज इम्पेंडिंग फेलियर इमरजेंसी है. सो डू यू नॉट थिंक कि अस्थमा का पेशेंट अगर इतना फ्लो में पेशेंट हॉस्पिटल में आ रहा है तो वेरी हाई चांस कि इम्पेंडिंग फेलियर का भी पेशेंट आएगा. देन तुमने रैपिड से ये लिस्ट बना ली है, इनको कंसाइज किए इतने पेजेस में. वो तुम्हारी अपनी पर्सनल लिस्ट है, मेरे पास अपनी पर्सनल लिस्ट है. तुम्हें चाहिए प्लीज टेक्स्ट मी. एंड ये तुम्हारे को लिस्ट मिल गई है, ये तुमको कंसाइज करना है इतने पेज में. दिस इज हाउ यू विल स्टडी मेडिसिन एंड दिस इज ओनली व्हाट विल हेल्प यू. मैं तुमको बताता हूँ मेरी मेडिसिन की कंसाइज बुक. दिस इज द होल ऑफ मेडिसिन इन वन बुक. ओके, तो यहाँ पे आई हैव my listings of everything, and ये cardiology start है. This is everything that is going to be needed in cardiology for me for MCQs at least. I have my MCQ book. This is whole of medicine for me. इसमें सिर्फ rheumatology नहीं है, because उस टाइम तक मेरा rheumatology complete नहीं हुआ था और मैंने काफी end में किया था. ये medicine है, and this helped me insanely when I was doing in the end. ये मैंने काफी end में बहुत use किया हूँ इसको मैंने. Everything I have added so many things later on कि यू सी दीज पोस्ट-इट्स ये सब बाद में ऐड हुए, बट बेसिक कॉन्सेप्ट जो कंसाइज का था ये स्टार्ट में हो चुका था, राइट. मूविंग ऑन, लेट्स से यू वेंट टू सर्जरी. अब सर्जरी इज अ वेरी टेक्निकल सब्जेक्ट टू मी. यू हैव टू अंडरस्टैंड कि यहाँ पे पहले से तुम्हारे को ये मिल गई है लिस्ट में, व्हाटएवर सोर्स यू यूज टू कंसाइज द लिस्ट, वो LRR हो या वो ऐप में से रैपिड रिवीजन वीडियोज हो, तो ये सारे तुमको यूज करने हैं. ये लिस्ट बन गई, इसी को तुमने कंसाइज किए. वंस यू हैव कंसाइज दिस हियर, तो उसके बाद तुम देखो फ्लेल चेस्ट न्यूमोथोरैक्स, यहाँ पे हीमोथोरैक्स है, उसका मैनेजमेंट, यहाँ पे इंडिकेशन क्या है थोरैकोटोमी का, ये एक कंसाइज लिस्ट हो गई. ये सिर्फ वो नहीं है, ये देखो सारे इंडिकेशन मेंशन्ड है यहाँ पे. उसके बाद अगर ये टेंशन न्यूमोथोरैक्स है तो ये इमरजेंसी है. क्यों इमरजेंसी है, व्हाई इज इट एन इमरजेंसी, ये तो तुमको अपनी अपनी लैंग्वेज में लिखना पड़ेगा ना. जब तुम ये लिख लोगे, ये डायग्राम्स है कि इसमें टेंशन में और ओपन में क्या फर्क है, ये उसका वर्सेस है, ये इमरजेंसी है, और ये डेफिनेटिव मैनेजमेंट क्या है, इमरजेंसी मैनेजमेंट क्या है. कलर कोडेड नोट्स है ये मेरी, थोड़ी सी ग्रीन जो होता है वो मैनेजमेंट होता है, और पिंक जो होता है ये पैथोलॉजी होती है, राइट. तो फिर उसके बाद ये जो है इस पे ऐसे क्वेश्चन आते हैं कि क्या क्या लेयर्स पीयर्स होती है. तो ये तो इतनी बार पूछा गया है ये क्वेश्चन, इसमें से विच ऑफ द फॉलोइंग इज नॉट पीयर्स, विच ऑफ द फॉलोइंग इज पीयर्स, ऐसे बहुत क्वेश्चन आते हैं. तो ये सब एनाटॉमी के थ्रू ही आएगा तुम. When you have started with anatomy, now you have seen कि respiratory anatomy से हमने start किया था. When we started with anatomy, we have flown in the way कि respiratory physiology तक तुम आए. Anatomy तुमने पढ़ गए, तुम you have understood the lung in the structured way, you have understood the pleura, then came the physiology, how the interpleural pressure changes, how breathing occurs. It is such a beautiful concept, how intercostal muscles cause you to breathe, and how the graphs changes in physiology because of that. The graphs are so important in physiology. They will constantly keep you in touch of all the subjects above and below. Then came pathology, you understood obstructive, you understood restrictive, you went to cancer, you went to allergies. All of this you did, and after you have done this, you came to pharma. तो pharma तो मेरा medicine में मैंने include कर दिया, इसलिए मैंने यहाँ पे नहीं लिखा हूँ. When the concise note, I have pharma and medicine together. So अस्थमा का लेटेस्ट मैनेजमेंट हो गया, एंड देन यू केम टू सर्जरी. फॉर एग्जांपल मेडिसिन आपका खत्म हो गया, अब सर्जरी में सबसे इंपॉर्टेंट क्या है. इन द लेटनेस ऑफ द एग्जाम आई हैव अंडरस्टूड that there are two type of questions in surgery. Those are favorite. There are many more. What is the best next step? This is such a question कि this is always asked. मेरे पेपर में भी इतने क्वेश्चंस थे. ये कस्टम्स में ये बहुत सारे क्वेश्चन आएंगे, पीवाईक्यूज में तुमको ये मिलेंगे, everywhere you will find. So when you study, please try to make a step wise note, या step wise लिख दो पोस्ट-इट पे और तुम्हारी नोट्स में चिपका दो कि this is the next step, this is the next step, this is the next step. So there is a topic in gynecology where shoulder dystocia, उसमें steps है of management. उसके ऊपर you will अंडरस्टैंड कि इतने सारे क्वेश्चंस पूछे गए हैं. इस बार क्वेश्चन था और इस बार उसका वीडियो क्वेश्चन. यू अंडरस्टैंड हाउ दे सिलेक्टेड द वीडियो क्वेश्चन. जो टॉपिक बहुत बार पूछा गया है उसका वीडियो बनाना इज नॉट डिफिकल्ट. यू आर वेल वर्स्ड विद दोज टॉपिक्स इफ यू हैव प्रेप्ड वेल. तुमने अगर पीवाईक्यू सॉल्व किया तो तुम वो टॉपिक कई बार देख चुके हो, राइट. तो वो टॉपिक का बस वीडियो फॉर्मेट है, वो थियोरी को हमने वीडियो में कन्वर्ट किया है, राइट. वो शॉक फैक्टर की वजह से बहुत सारे लोगों को अटेम्प्ट करने नहीं हुआ. मुझे भी, मेरे भी काफी सारे लॉसेस हुए उसमें, बट इट इज फाइन. दैट इज पार्ट ऑफ द गेम. यू विल ऑलवेज हैव अपडेटेड फॉर्मेट्स, right? Once you finish with surgery, so your respiratory system comes to an end. Now I'll concise it for you, right? Let's say you started with anatomy, you understood the structural anatomy of things, you went and you you completely understood the structure and imaging. तुम्हारे को अप्रोच सेट हो गया दिमाग में कि इसकी इमेजिंग चाहिए मुझे. एनाटॉमी में कहीं कहीं इमेजेस वहीं एक्सप्लेन होते भी है. तो once you understood the anatomy, you went to physiology. How in the respiratory system, what causes the breathing? कैसे, कौन सा सिग्नल आता है, केमिकल रेगुलेशन कहाँ से आता है, न्यूरल रेगुलेशन कहाँ से आता है, what causes, what changes in the anatomy that causes the negative pressure to generate and the air comes into your system, how the partial pressure of oxygen changes, how oxygen is transported, ये सब तुम्हारे को physiology में आ गया. Once you come here, once you are into the physiology of things, you will understand why the pathology occurred. Right? ये continuum हो गया. If you had read anatomy of thorax, you went to anatomy of abdomen, then after such a long time you came back to the फिजियोलॉजी एंड पैथोलॉजी, तो वो लिंक टूट जाता है. दैट इज ऑल. इन वर्टिकल फॉर्मेट या हॉरिजॉन्टल फॉर्मेट, इधर वे तुम्हारे को इट इज गोइंग टू बी द सेम, बट कंटिन्यूम में यू विल स्टडी मच बेटर. ओके, व्हेन यू गो फॉर पैथोलॉजी, नाउ पैथोलॉजी में यू अंडरस्टूड कि हिस्टोलॉजी तुमने पढ़ लिए थे, you revise histology there, and then you go to normal histology. Once you read a normal histology, you should move on to pathology, core pathology. When you go into pathology, you will understand कि अच्छा ये disorder में ऐसी change हो रही है pathology, ऐसी cause हो रही है pathology, this disorder causes this, that disorder causes that, and then you have a general idea कि okay, anatomy normal was this, pathology में this changed, physiology normal was this, physiology में this changed, so this pathology occurred. And the etiology of this pathology was this. Let's say कि you are reading about asbestosis, right? तो asbestosis जो है, the shipyard worker है, उसके lungs के base में settle हो गया asbestos. Why did it settle? Why the particle of that side went down? ये सब कुछ तुमको तभी समझेगा ना, when you have a better idea of the anatomy of the bronchial tree, how they angulate and how the cartilage is lost eventually and they collapse on negative pressure and everything. तो ऐसे ये when you get this part, the pathology becomes easy. Pathology में the only difficult part to me was interleukins and all, but then when you solve too many questions, it stays with you. So don't be scared. Don't take stress कि इतना सारा interleukins कैसे याद होगा. वो जहाँ है, read about it, revise it, वो रह जाएगा. It will stick. Nobody can take it away from you. Okay. Then radiology, you have to first understand the normal radiology of the lungs, for example, when you and the thorax. Once you have done it, you have to understand how many modalities are there. Once you understand how many modalities are there, then you can go for individualistic pathologies. You have to understand those pathologies. जैसे कि ब्रोंकोग्राम साइन क्या है, ये तो जनरल साइंस है, ये तो कुछ चीजों में कुछ स्पेसिफिक, कुछ चीजों में कुछ और स्पेसिफिक. एंड देन यू हैव टू अंडरस्टैंड द कोर पैथोलॉजी, और फिर वो कोर पैथोलॉजी की इमेजिंग कैसे दिखती है, या वो इमेजिंग में क्या चेंजेस दिखेंगे, या व्हाट टू एक्सपेक्ट होना चाहिए. देन आता है मेडिसिन, अमेजिंग सब्जेक्ट. It will revise everything for you, from anatomy to physiology to patho, pharma, radio, everything will be revised, or the stuff can go into surgical side. Once it goes into surgical side, it is like maths. 1 + 1 = 2. तुम लोगों को कुछ क्राइटेरिया याद रखने हैं, दोनों मेडिसिन में भी सर्जरी में भी. Once you understand the criteria, you have to go for surgery. Pre op, post op सारा जनरल में आता है. You have to read the general part of it. The general surgery, general pathology, general radiology is very important. It will stick with all the subjects, all the systems, everywhere you will use it, right? Then you have to go, I will show you an example of how, what questions were asked. अब तुमने system देख लिया, right? Let's say you go for this question, right? यहाँ पे you have to just, अब PYQs कैसे solve किए जाते हैं, I'll tell you. Let's say you are solving this question जिसमें facial palsy के बारे में question है. तो तुम ये क्वेश्चन सॉल्व कर लो बेशक, ओके, नो प्रॉब्लम, यू आंसर्ड दिस क्वेश्चन. बट व्हाट टू टेक अवे फ्रॉम दिस, तुम्हारी पीवाईक्यूज की जो सेपरेट बुक है उसके अंदर व्हाट यू हैव टू ऐड, यहाँ से यू हैव टू टेक कि यहाँ पे हमारे को फेशियल पाल्सी के बारे में पूछा था, तो ये टॉपिक इंपॉर्टेंट हो जाता है बाय डिफॉल्ट. नाउ मेंटेन टैलीज कि कितनी बार पूछा गया है ये पहले. नाउ अब हमारी प्रेप में हम क्या चेंज करेंगे मालूम है, नेक्स्ट कि जो टॉपिक बहुत बार पूछा गया है ना, उसके तो वीडियोस करने ही है. why can't they ask a video about facial palsy का पेशेंट देखे कि what nerve is damaged, या फेशियल पाल्सी है अगर पेशेंट को, तो क्या ये अपर मोटर न्यूरॉन है या लोअर मोटर न्यूरॉन है, क्यों नहीं पूछ सकते इसका वीडियो? ऑब्वियसली पूछ सकते हैं. फेशियल पाल्सी तो इतनी बार पूछा गया एग्जाम में, कई बार पूछा गया. तो तुमने ये वाला, यू रेड दिस क्वेश्चन, यू अंडरस्टूड, यू आंसर्ड व्हाटएवर द आंसर वाज, बट यू व्हाट टेक अवे वाज कि फेशियल पाल्सी इज एन इंपॉर्टेंट पीवाईक्यू. ये पीवाईटी मिल गया तुमको. तो अब फेशियल पाल्सी पे मत रुको, गो फॉर ऑल द क्रेनियल नर्व. सारे क्रेनियल नर्व के प्रेजेंटिंग सिम्टम्स पढ़ लो, उनके प्रॉब्लम्स में क्या होते हैं. ये हेड एंड नेक में यू विल गेट, right? Head and neck में once you get that, you have to understand कि वहाँ पे neuronal columns है, you have to understand the whole anatomy of how the nerves look, क्योंकि they ask image questions, image based questions आते हैं वहाँ पे, and वो IBQs में they also point the arrow on a specific nerve, and they will ask you ki what kind of pathology is expected. Yeah, this is just my language, but they will give you a few symptoms. Let's say they mark the third nerve, so oculomotor palsy hogi, so they will give you के options में से the eye will be down and out and all, so down and out will be answer ऐसे. So these are also the kind of questions that can be expected. But do you have to understand that when you read head and neck is you integrated ophthalmology, that becomes a lateral integration to both subjects. That is very important. When you do that for your studying, MCQs become easier. So yeah, you did this for anatomy, right? This takes a lot of time, by the way. And then you moved on. Okay, second question. Now you see surgery and anatomy are integrated. Okay, so you will only understand the complication of surgery when you know anatomy, when you know the imaging of those things. So this is one of the very favorite questions also, by the way. लेकिन high pitch sound नहीं आ रहा है वो, the patient develops difficulty, तो क्या हो रहा है, वो patient का जो सर्जरी में कोई तो नर्व डैमेज हुई है, तो वो पेशेंट हाई पिच साउंड नहीं जनरेट कर पा रहा है. नाउ इट इज नॉट अबाउट दिस क्वेश्चन. तो इसका टेक अवे ये है कि यू हैव टू अंडरस्टैंड कि सर्जिकल थायराइड जो हम करते हैं उसमें नर्व इंजरीज होती है. तो लिस्ट आउट ऑल द नर्व इंजरीज दैट आर पॉसिबल, मोस्ट कॉमन ढूंढ लो, मोस्ट डेंजरस ढूंढ लो, तो ये उनका मैनेजमेंट पढ़ लो. ये हो गया तुम्हारा पीवाई की पढ़ने का तरीका. सारे तुमने नर्व्स निकाल लिए सर्जरी में से, ऑल द नर्व्स दैट आर पॉसिबल टू गेट इंजर्ड यू हैव फिगर्ड इट आउट. देन यू हैव लिस्टेड आउट की हाउ मेनी पॉसिबल कॉम्प्लिकेशंस कैन बी देयर, एंड देन उसके वीडियो क्वेश्चन पे चले जाओ ना. यू हैव टू अडेप्ट टू द न्यू सिस्टम कि व्हेन द पेशेंट कम्स विद दिस कॉम्प्लिकेशन ऑफ नर्व सर्जरी, इंजरी टू द नर्व, देन हाउ डज द पेशेंट लुक. You will get this everywhere. The app will upload. You can search it on YouTube. Everywhere you will get it. So just develop a habit of watching the video there and there. Okay. If you want, you can save the video. If you don't want, you can always keep searching for the video online. Right now, you see, this is a clinical question. This is anatomy integrated clinically. Right. The patient presents with a sign and what nerve is damaged. So पहले तो first you have to understand कि ये जो सारे nerve है, तो ये तो देख के पता होना चाहिए कि हाँ अपर लिम्ब के नर्व्स है भाई. ओके फाइन. वंस यू अंडरस्टैंड कि अपर लिम्ब के नर्व्स है, तो यू हैव टू नो द एनाटॉमी ऑफ द अपर लिम्ब में कौन सी नर्व किधर से पास हो रही है. वंस यू नो दैट, देन यू हैव टू अंडरस्टैंड कौन सा मसल, कौन सा टेंडन, कौन सा क्या मोशन देता है, तो व्हाट काइंड ऑफ moment is generated, right? So now if the patient clinically presents with something, ye dekho, sir has done it, this is Dr. Azam, and he has done all of this in one single page. You see, the activity of putting everywhere concise will always help you. Unka Dr. Azam has a LRR session. It is brilliant. He has done anatomy in a way that I could have never imagined. They will always help you, those LRR sessions. And you see, when this is like after the MCQ, the explanation जो होता है कस्टम में हो गया या कोई भी MCQ हो गया, उसके नीचे जो explanation होता है, this is a picture of that. You see how this is used in MCQ. You solve the MCQ, you get the explanation, you understand the explanation, it will help you further in other MCQs. So explanation of MCQs are extremely important. Okay, so what to take away ki, okay, if one sign was mentioned ever in the exam, and this is also a very favorite question of the exam, so you have to understand what are the limb signs, what are the nerve involved, how are they corrected, what kind of correction is there, what is the etiology. सारी की लिस्ट आउट करके छोड़ दो ना एक जगह. So when you further solve another question like that, you will always have an index to go back to. Okay, when you are, let's say you did not remember it, but you will always know in the head, ki, okay, if I read about radial nerve somewhere, the presenting sign of radial nerve, I also have an index already made for median nerve. So you just have to go back, look at it. When you constantly keep doing that, it will stick. It will 100% stick. It will always be there. Okay. So when you solve GTs, let's say GT में तुम्हारा क्वेश्चन गलत आ गया रेडियल का, so you go back, you read all the nerves again. Once you read all the nerves again, then you have generated a longer memory, and also you have to keep revising those index that you create. So ये PYQs करने का approach है. Let's say next ये these questions were asked in this session, right? The patient came in with a stab injury, right? Once you understand कि stab injury कहाँ है, patient crash हो रहा है, if the stab injury is in the chest, so trauma का case है, so go back. You said कि you noted that trauma is being asked, chest trauma. So why stop at chest? Go for chest, go for the whole thorax, abdomen, other limb traumas. सारे trauma की एक list बना लो. When you're solving PYQs, no, do it like this के वहीं or when where you have studied, no, just either take a photo of it and concise it कि ये मेरा PYQ का एल्बम है. सो उसका पूरा लिस्ट आउट कर लो कि सारे ट्रॉमास प्रीवियस ईयर्स में सारे ट्रॉमा का एक कॉलम बना के रखो. दिस ट्रॉमा. नाउ व्हेन यू कम टू सॉल्विंग वीडियो क्वेश्चंस, राइट, वंस यू आर एट वीडियो क्वेश्चंस, तो कैसा प्रेजेंटिंग सिम्टम होगा ट्रॉमेटिक पेशेंट का इसमें चेस्ट ट्रॉमा में, व्हाट विल बी द प्रेजेंटेशन या व्हाट विल बी द कॉम्प्लिकेशन दैट द पेशेंट विल कम विद. इसका वीडियो देख लो, इसका इमेज देख लो. Once you understand that, ये ट्रॉमा को कंसाइज कर लो, तो पीवाईटीज निकलते जा रहे हैं ना तुम्हारे पास. प्रीवियस ईयर टॉपिक्स में तुम्हारे को कितना कुछ मिल गया कि लिम्ब नर्व्स आ गए, यू गॉट ट्रॉमा का केस, यू गॉट क्रेनियल नर्व्स, यू यहाँ पे इसके चेस्ट ट्रॉमा के साथ यू ऑल्सो गॉट अदर ट्रॉमास इन द बॉडी, एब्डोमेन ट्रॉमा या पियर्सिंग ट्रॉमा या ब्लंट ट्रॉमा. फिगर इट आउट देन एंड देयर. ये पीवाईटी कर रहे हो ना, तो जस्ट डू एवरीथिंग. डोंट जस्ट सिट लाइक अ डम एस एंड एक क्वेश्चन सॉल्व कर लिया एंड मूव ऑन. डोंट डू दिस. वो पीवाईटीज जनरेट करने का आदत डाल दो, बिकॉज व्हेन यू जनरेट पीवाईटीज, योर half of your problem is solved. You know what the previous topics were, and in the start it seems very helter skelter कि यार मेरे एक टॉपिक ट्रॉमा लिख दिया हूँ and then there is only one chest trauma मैंने मेंशन किया हूँ. In the longer run, the whole list will be complete. I am shocked of the list that I have created. I am like in the utter awe that oh my god कि ये भी हो सकता है. So trust yourself, trust the process. Okay, then ये फिजियोलॉजी का क्वेश्चन था. ये ग्राफ, there were 3 or 4 graph questions in this exam, this session. You have to understand कि these graphs are always asked. There will be no exam that goes without a graph question, because graph will always test कि how much you know the whole concept. तो सारा कॉन्सेप्ट लग जाता है ग्राफ समझने के लिए. एवरी सिंगल थिंग. ग्राफ्स जो है फिजियोलॉजी के ग्राफ्स, दे आर अमेजिंग. You have, if you don't understand the graph, that is a clear indication that you have not understood the concept, right? So this graph is very very important. यहाँ पे ये I think cardiac graph है exactly. So this is the cardiac graph. ये graph का every single thing you should know. You have to superimpose on this graph the JVP findings. You have to superimpose की pulse कैसे change होगी, S1 कैसे change होगी. Sir has explained every single thing, right? So moving on. Now I have added one pediatric question why. I'll tell you कि ये question है ना, ये I think Hirschsprung disease का question था, and you have to take a biopsy. ये चीज if you had not read in pediatrics, you have already read this in surgery. Surgery will already tell you Hirschsprung disease में तुम्हें biopsy लेनी होती है. But pediatrics is a combination of all the subjects, all the integrated subjects into one for children. Okay, it is extremely scoring. Because when you study pediatrics, na, everything gets revised. So when you are revising everything, it constantly goes in to the revision mode. You already know the part. All you have to change is how much dosing will be changing, or what if the test is avoided. जैसे GIT systems में ना, we avoid X-rays in children, so we go for USG पहले. But you have to understand कि FMGE में investigation of choice is one of the most favorite topics. What will be the investigation done next, या what is the best investigation? ये दो questions इतने सारे थे इस पेपर में भी, PYQs में भी, everywhere they were there. Now coming to grand test. When do you start grand test? Everybody told me कि you should start grand test as early as possible, but I was stubborn and I did not, and it was a mistake. I never understood why they say if you haven't studied the first grand test that I attended, I got 64, and that was an extreme disappointment to me. And I never understood why they told keep do पहले दिन से grand test do and do everything. But eventually I understood why, because first of all you have to generate the mental capacity to go for 300 questions. like at least 150 in one sitting. Your brain starts to get saturated so quickly in the early phases that you have to generate a capacity to go and keep your brain active and not get tired for 150 minutes. You are physically getting tired sitting, and you are also getting tired mentally by thinking about each and every topic. So you have to understand कि start का grand test is not for your scoring concept. Start का grand test, though you generate the habit and try and give the grand test at the same time. सुबह का पेपर होता है ना, वैसे ही 1.5 घंटे का जो 150 क्वेश्चन का जो पेपर होता है, सेट द टाइमर, गिव द ग्रैंड टेस्ट, टेक द ब्रेक, गिव द सेकंड पार्ट एंड फिनिश इट ऑफ. नाउ when to give is day one से. If you are starting today, start the grand test. जाओ पुराना grand test use करो एक, and take the experience कैसा है, how much capacity do you have, do you have the mental capacity to think for the whole 300 questions. If not, then you have to generate the ability to do it. And then when to give is from the start, obviously. Always from the start. The initial parts are for your ability. Then when you review the grand test, no, you will also understand कि okay, those questions will stay with you that you did not understand, and eventually when you read, you will understand कि वो क्यों था GT. And when you are reviewing the GT or when you come back to the GT, eventually very late, for example, then you will see, oh, I did not know this before, now I know this. Then you have created like novelty in your brain. Now, how to review the grand test is I reviewed it system wise. So when you give the GT, your result comes in a segregated format. This subject, this subject, this subject. Okay. So go to the subject, go to your notes, open your notes, and review it. वहीं के वहीं, that this was never mentioned. I did not know this. And I have seen many students also doing this. I did it mentally. I never did it actually, man. But you should do it. It is a very good thing. You have to divide your mistakes into a few groups, and the groups are key. It was a silly mistake. You knew it. You just picked the wrong one. You have to divide it. I never knew the topic. I thought of something else. Like this is a proper mistake. This was my thought process. Try and figure it out why you thought differently. If you start doing that, you will always know ki, acha, this is where my thought process went wrong, and I have to change this. Obviously, then these are the few divisions that you have to make. Silly mistakes, proper mistakes. I never knew the concept. If you have not done the subject, keep it there. ये subject हुआ नहीं था. Eventually, when you are listing, no, the subject will shift. There will be lesser subject. It is very good mentally. You have to always judge your subject-wise performance. अगर तुमने, let's say you have recently studied respiratory medicine and तुम्हारे GT में last में respiratory medicine है ना, you have done something wrong. This cannot happen. Don't put the habit कि ये मैंने गलत इसलिए आया क्योंकि I have not revised. नहीं, you have read it, you have the idea. गलत क्यों आया वो ठीक है, वो तीनों में it's fine to get it wrong, but it should not perform. Your performance should not be like you never knew the subject only. अब भी तुमने पढ़े हो and you did not know the subject, something is wrong there. Change it, revise it वहीं के वहीं, and your revision strategy will be built on the subject-wise performance. You will use this for revision and integrate how to integrate GTs with your revision, right? So let's say you are giving a GT and you have not finished respiratory surgery, and you gave the subject and you realized there were few questions about surgery, and thoda bahut I understood what was being asked, but I did not know the surgical process, so I could not answer. Go when you read the surgery, no? Then you go and read surgery, you will understand, okay, so ये question was asked. So GTs इसलिए you have to give in with your preparation constantly. You will understand how you have to change your study pattern. That is how. So let's continue the example कि you were giving you did not perform well on surgery of respiration, and then you got a few questions, you got them wrong, and now you're studying. So now when you're making your concise notes, you use those questions to mention there, then and there. Okay, and when you finish a subject, all the tests you have given previously, go and review it once. When you go back so many times, question ही याद हो जाएंगे, explanation याद हो जाएंगे तुमको. So you have to do it like that. Okay. Then how to solve customs. Customs are the literal cheat code to everything. Customs will help you discover things about the subject that were never in your brain. When to solve? Let's say you studied anatomy, you finished anatomy. Abhi, go and solve 100 questions. अभी के अभी फिनिश इट ऑफ. The customs should be a part of studying. ऐसा नहीं, customs are not a separate thing. When you study the theory, customs वही कर लो. You have to understand the exam is an MCQ exam. You are training for MCQ. So just theory पे रुक गए ना, so you will never be able to convert it. The conversion factor will be very less. Okay, so please generate the habit of solving customs then and there. 100 questions are what they take, though they don't take so much time. So how to review? I do not do it in the test form. I keep it like I will click the answer. If it is right or wrong, each explanation I'll read and I will mention it in my book. And then when I'm revising, I will use that book. So मेरा दोनों part continuously चल रहा है. Hashtags, how to use? I will tell you hashtags, and you have to generate an hashtag for IBQs separately. You have to use DOC and you have to use investigation of choice. सही है. ये तीन के अराउंड चलाओ. इसमें एडिशनल लेवल रहेंगे प्रीवियस ईयर क्वेश्चंस. इसमें पीवाईक्यूज ऐड करो, इसमें सब में पीवाईक्यूज ऐड करो. इन सब में तुम सारा एडिशनली क्लिनिकल सिनेरियोज ऐड करो. अनदर हैशटैग एम्स के क्वेश्चन यूज करो. And you should also use like criterias, because medicine surgery both have criterias. Pathology में भी बहुत criterias है. And you have to mention criterias. Don't act lazy with the hashtag. The hashtags are very important. So create hashtags. इमेज बेस्ड का हैशटैग क्रिएट करो, ड्रग ऑफ चॉइस का हैशटैग क्रिएट करो, इन्वेस्टिगेशन ऑफ चॉइस का हैशटैग क्रिएट करो, नेक्स्ट बेस्ट स्टेप का हैशटैग. ये सारे अलग है. सो यू कैन आइदर डू 25-25 में डिवाइड करके, और यू कैन कीप गोइंग एंड लाइक सारे एक साथ भी कर सकते हो. बट आई प्रीफर इट डूइंग डिफरेंटली बिकॉज देन प्योर क्वेश्चन आते हैं उसके. देन हाउ टू इंटीग्रेट विद दिस विद द रिविजन. सो व्हेन यू आर डूइंग रिविजन, नो, let's say you finished anatomy, you did the custom, then you moved on to physiology. Now let's say you are studying physiology, you finished physiology today. Physiology के 100 क्वेश्चन कर लो एंड 25 क्वेश्चन एक्स्ट्रा कर लेना एनाटॉमी विद फिजियोलॉजी के. ऐसे सारों को ऐड करते जाना. एनाटॉमी फिजियो पैथो, एनाटॉमी फिजियो पैथो फार्मा. दिस विल हेल्प यू गेटिंग बेटर क्लिनिकल क्वेश्चन. बाय द एंड यू रीच मेडिसिन एंड सर्जरी, यू विल ऑलमोस्ट नो एवरीथिंग पहले से. डोंट गेट disheartened if you get questions wrong, because customs are meant to teach you newer things. जो थियरी में कभी कभी कवर नहीं होता वो कस्टम्स में होता है. सो जो कंप्लीट स्टडी है, यू हैव टू ऐड कस्टम्स टू योर preparation, right? Once you are done with customs also, customs are actually very important. Now comes the revision. Let's say you have finished the system. Ab, how many times should you ideally revise? The answer is 5 times. Ideally, you have to revise 5 times plus one, the main revision, the main reading that is there. Okay. Once you have done those, so what you have to do is, ये main reading था. Main reading में you develop the concise notes. सही है. This is what is to be revised 5 times. The number is absurd. When I heard it for the first time 5 times, and I'm thinking कि मेरा watch time is like thousands of hours. How am I going to do 5 times? So the bridge is कि when you read the first time, concise it. Though that concised format of the subject is to be read 5 times. And that concise should be constantly updated. With customs you have to add, with GTs you have to add, with the newer other subjects may, when you get the relevant part of respiratory, for example, you are reading cardio may, when you read heart failure, you understand why dyspnea develops. तो वो dyspnea तुम इधर भी मेंशन कर दो कि dyspnea में ये फाइंडिंग आएगी, ये चेंजेस आएंगे पेशेंट के ब्रेथ पैटर्न पे. So that is what is to be revised 5 times. Revision, you can't stick to theory forever. You have to concise, go to MCQ. Concise, go to MCQ. Okay? Then, this is ideally 5 times. How to structure it? Let's say कि I will give you a strategy here. Let's say कि the whole of पढ़ाई में you have 100 watch hours, 1000 hours of watching. This is just an example. There is a whole different thing. Now, तुम्हारे को you are left with 150 days. सही है. 150 days में the first watching is of 1000 hours. ये जो 1 है, this is 1000 hours का. तो तुमने 1000 hours को divide कर दिए 50 days पे, that is 20 days लगेंगे. सही है. समझ गया. तो ये जो 20 है, इसमें तुम्हारे को फिट करना है उसको. 20 hours बन रहे हैं. Sorry, these are 20 hours. So these 20 hours should be divided over 50. So this is too much, no? So you divide this 1000 hours by let's say 80 days. Okay, 12 hours. 12 hours you can stretch and in a day. 12 hours को तुम थोड़ा सा लीवे दे के रख लो कि 80 days की जगह फिनिश इट इन 100 days. तो 100 days में if you give 12 hours a day, you are going to finish it off all the things. ठीक है, दिस इज हाउ यू हैव टू फिनिश. अब व्हेन आई वाज प्रिपेयरिंग, आई थिंक देयर वाज 1350 समथिंग ऐसा आवर्स का वॉच टाइम था, ऐसा कुछ तो था, एंड आई डिवाइडेड इट. सो द होल आइडिया इज व्हाट कि फाइंड योर होल, जो भी तुम्हारी स्ट्रेटेजी है, जहां से भी तुम पढ़ रहे हो, उसका पूरा डेटा लो कि इसको इतना टाइम लगने वाला है, डिवाइडेड बाय योर होल डेज, कि लेट से 150 डेज बचे हैं. देन एडजस्ट थिंग्स कि अच्छा इसको लीवे दे देते हैं, यहाँ पे रिवीजन ऐड कर देंगे तो इतने एक्स्ट्रा आवर्स ऐड हो रही है. ये सारा, ये जो न्यूमरेटर है इसमें तुम्हारा सारा रिवीजन एंड ऑल एमसीक्यूज वगैरह सारा टाइम ऐड करो, तो तुम्हारे को डेली टाइम मिल जाएगा कि इतना दिन में तो मुझे आवर्स डेडिकेट करने हैं. और फॉर द नेक्स्ट 6 months प्लीज पूरा दिन डेडिकेट करो. डोंट बी स्टूपिड, बिकॉज यू डोंट वांट टू बी द रिपीटर इन द प्लेस की जहां पे इतना पैटर्न चेंज हो रहा है. यू डोंट नो व्हाट्स कमिंग नेक्स्ट. ओके, ट्राई एंड गेट इट इन द फर्स्ट गो, एंड तुम्हारा सारा जो ओवरऑल टाइमिंग है उसको तुम्हारे डेज से डिवाइड करके नेक्स्ट 5 months के लिए तुम्हारा प्लान प्रिपेयर कर लो. फिर सेकेंड स्टेप इज यू गो अहेड एंड अरेंज द सब्जेक्ट्स इन ऑर्डर कि आई एम गोइंग टू डू एम्ब्रियोलॉजी, अभी इतने दिन में एम्ब्रियोलॉजी आई विल फिनिश, इतने आवर्स है, अगर इसको आवर्स को मैं मेरे डेज में पुट करूँ तो इतने दिन में एम्ब्रियोलॉजी फिनिश हो रहा है. एम्ब्रियोलॉजी के बाद प्लीज मूव ऑन टू whatever subject you are moving on to. Once you start the integrated subjects, go to integrated subjects and वहां पे जाके अपना ऑर्डर डिसाइड करो कि ओके आई एम गोइंग टू स्टार्ट विद थोरैक्स, देन कार्डियो, देन एब्डोमेन, देन रिप्रोडक्टिव. ये अगर सारे मेरे हो गए, देन आई विल क्लब इट विद गायनेकोलॉजी. ये ऑर्डर डिसाइड करो, अपना 5 महीने का प्लान रेडी रखो एंड फॉलो इट. डोंट थिंक कि मैं आई विल गो विद द फ्लो एंड ऐसे हो जाएगा. नहीं, द प्लान विल कीप चेंजिंग. आई चेंज माई सब्जेक्ट ऊपर नीचे हजारों बार, बट इट इज फाइन. ऐसा करना ओके, कोई दिक्कत नहीं है. सही है. देन मूविंग ऑन की रिवीजन अगर तुमने ऐसे सेट कर दिए तो लास्ट 20 डेज में क्या रिवाइज करना है. तुम्हारा एक रिवीजन लास्ट 20 डेज को जाएगा. ठीक है, तो वो जो लास्ट 20 डेज रहते हैं ना, ये 5 में से एक इधर आता है. तो तुमने हमारी यू हैव मेड योर कंसाइज नोट्स. वंस यू हैव मेड योर कंसाइज नोट्स, नो सारे सब्जेक्ट के रेडी हो गए कंसाइज नोट्स, 20 दिन में कर लो. 19 सब्जेक्ट है, एक दिन एक को डेडिकेट करो और सॉल्व करते रहो एमसीक्यूज पूरा दिन. व्हेन यू डू लेट्स से डे 1 को यू स्टार्टेड विथ योर एनाटॉमी, तो तुम एनाटॉमी को रिवीजन करोगे. जब एनाटॉमी का सिस्टम पढ़ लिए तुमने, तो सॉरी रेस्पिरेटरी का, यू हैव रेड योर रेस्पिरेटरी सिस्टम, रेस्पिरेटरी का कस्टम बनाओ, डू हाउ मेनी क्वेश्चंस यू वांट टू इन द डे. देन व्हेन यू मूव ऑन टू कार्डियक, नो डू रेस्पिरेटरी एंड कार्डियक के एमसीक्यूज, बट रिवाइज ओनली कार्डियक देन, because 20 days के लिए it's enough, because this will be a third, fourth, fifth revision, so it is enough. So once you do that, do it like that. Now last 20 days में you have to revise it like that कि for day 1 को I will be revising my रेस्पिरेटरी सिस्टम, डे 2 को कार्डियक सिस्टम. ऑलरेडी प्री सेट रखो ब्रेन में, ये तब 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 करना है. बिकॉज इफ यू ट्राई एंड रिवाइज द होल मेडिसिन, ये 4 दिन में नहीं होगा. But you can easily revise the system that you have read so many times. You have solved the system in MCQ format so many times. So last 20-30 days में ये करो, relax. That is the time to slow down a bit, not slow down. Slow down a bit. You can't do newer things. Okay, you have not finished a subject. Okay, one subject is not going to finish off your exam, but that subject should not be PSM or gynecology or medicine, right? If you have not completed the subject, it's fine, but you have not studied the subject at all. This can't be a bigger subject. It should be a very small subject, like maybe derma you have not been able to finish, but medicine में यहाँ वहाँ dermatology थोड़ा बहुत cover हो जाता है, तो it is okay. Then that is the strategy कि ये जो concise notes है that you are going to prepare, that you watched the main video, you took out the crux, you wrote down your concise notes. This note is ready for the last 20 days and also the revision. So with the revision बीच में you have to modify your notes, you have to add things you get, and then for the last 20 days you revise this in a day. The whole system should be done by the day. Okay, then moving on to this is my favorite thing about LRR, and thank you to LRR because for creating this whole thing. These series are available free of cost on YouTube, and these are going to help you so much you have never imagined. Okay, LRRs are the tool of everything. Okay, LRR will be like, they actually PrepLadder hosts last 20 days में they give you a schedule of LRR. Every year they do it. They give you a schedule कि we are going to do this LRR here, LRR there, LRR here, LRR there. But the only problem that happened with me was कि LRR was for the whole subject. Obviously, you see here, Preeti ma'am did it for whole pathology एक साथ में. So अमेजिंग, ओके कूल. जितने भी आवर्स का उनका है 3 4 5 6 घंटे का, सिट एंड वॉच एलआरआर. यू कैन आइदर गो फॉर दिस स्ट्रेटेजी और यू कैन रिवाइज योर नोट्स, either way. But the whole idea is end में MCQs करने हैं दिन में, लास्ट में MCQs करना is very very necessary. LRR are just the rapidest revision, they are amazing. वो पूरा schedule जो देंगे, maybe adjust your studies according to that. Now this time on I think 14th of June को एक टेस्ट हुआ था. It was called the FMG simulator test, and it was the closest test to the main exam. Absolutely, I'm ready to go against anybody who says otherwise. It was literally the format, the layout of the page was also like the exam. The questions were very similar to the exam, and the pattern of questions was absolutely phenomenal. They tried to simulate it. I scored 197 on that. And it is always said that when you give the last ke 2-3 PrepLadder ke exam, you are either +10, -10, +20, -20. There only. I got 197 there. I scored 211 in the exam. So please follow LRR sessions. Those are amazing. So I would, and special thanks to Preeti ma'am. I plead to you, whatever platform you will use, whatever you will do, there is nobody I found much better at microbiology explanation than Preeti ma'am. Preeti ma'am is the best for microbiology. The way she gives you some of the mnemonics, they will stay with you for the rest of your life. She has the most amazing ability to concise things. Even if you do LRR, to me, LRR was like microbiology LRR was amazing. I was able to recall everything, and her mnemonics, her stories about the microbiology things are amazing. So please, whatever you do, if you are preparing for FMG, if for the January FMG, please watch LRR by Preeti ma'am. If you want, you can watch all the LRRs of the past year for pathology at least. Anatomy के LRR जो है ना, I used LRR for anatomy by Dr. Azam in the last days, but I used to watch old LRRs also. So I use the old LRRs for the topics wise, and like whenever I'm bored, I used to watch LRR key, what is the discussion going on. And Dr. Azam has concised the notes. Essay key, he went from top to bottom, from neuro to limbs he went, and he explained everything. In one single LRR video, there is he has explained about the nerve injuries limbs ke. From that one video, there were 3 or 4 questions single, सिर्फ LRR से, because he explained all the nerve injuries there, and सारे questions nerve injuries के थे, almost सारे. So there was this exam, surprisingly enough, there was no question for image based neuroanatomy, which is always there. सारे exams में आता है वो. Okay, Deepak Marwa, I think people who don't know PrepLadder also know Dr. Marwa. He is like the goat for medicine. And special thanks to Dr. Manish. He in the LRR video, he has clips of his own patients, even giving anesthesia, performing tests, everything he has added. He has it in LRR, not even the main videos I'm talking about. I'm talking about LRR. He has included those videos in older LRR I'm talking about. In the older LRR, there is a video of where there are videos of his own patients. He has taught you on the patient. So that is literally the video questions those were asked. Okay? He showed a video of ophthalmometer. That was the question in the exam. सही है. Then pharmacology, the doctor has pharmacology is a challenging subject for me personally. There are too many drugs, but he has concised the drugs in a beautiful manner. He goes system to system to system, and then he gives you the list of the most important drugs. He is amazing at explanation. His mnemonics are amazing. The way he discusses it. When to watch, in my opinion, you have to watch it twice. Like not just twice. I mean, you can watch it as many times as you want. The 2 places that you should watch is, one is before the subject to get an idea what they are talking about. Is a short subject. I think everybody is a fast watcher. Everybody watches it on 1.52. So before the subject, get an idea what the subject is about. यहाँ पे you have to just take away कि okay, these are the subjects that are going to be discussed, and after में तुम्हारे को it will help with MCQs obviously. So if you want to watch it after, well and good. You should watch after. And the third and the final is when they release the LRR from prep, they will release the LRR. They will give you the whole schedule ki watch it, watch यहाँ पे करके ये subject के बाद ये they will cover. So that is also one of the most amazing times to watch. What to take away? I told you the important topics. How it is useful in the end phase is उनका schedule, PrepLadder का अपना schedule follow करोगे so you will be in a much better place because you don't have to plan stuff. So just know कि उनका अपना schedule होता है. You can watch it ऊपर नीचे, but then if it is not released yet, you have to watch the old one. So it is better you associate your pattern with LRR. एंड हाउ टू सेग्रीगेट वॉच टाइम, ये कॉन्सेप्ट बहुत इंपॉर्टेंट है. प्लीज कैलकुलेट ओवरऑल सब्जेक्ट का टाइमिंग या ओवरऑल मेडिसिन जितना भी तुमको पढ़ना है, जहां जहां से पढ़ना है, डे 1 को सारा वॉच टाइम जमा कर लो, उसको डिवाइड कर दो बाय द नंबर ऑफ डेज यू हैव, उसको एक्स्ट्रा लीवे दे दो, डिवाइडेड बाय अ लेसर नंबर ऑफ डेज. अज्यूमिंग कि तुम्हारे पास लेट से 150 डेज है तो 100 डेज में फिनिश करने की कोशिश करो. सो यू गेट टाइम फॉर रिविजन एज वेल एंड यू हैव टाइम. फ्यू डेज यहाँ पे obviously miss होने वाले, some emergency, some family thing you have to go and miss, but always remember कि यहाँ पे you have to know कि किस दिन कब खत्म क्या करना है. You have to give extra effort someday you will have to give lesser effort, but it will go on. Okay, once you are done with LRR, this was my strategy to do it, and amazingly enough I am thankful कि this worked for me. But you have to realize that every single day I went out of my house. There were friends of mine who never left their house in the prep time. They did clear the exam, but that I cannot do that. And I used to go out of my house for half an hour every single day. These are my friends. I am so thankful for them. They kept me sane. And who you sit with, who your family is, how they talk, everything matters in the prep. Don't listen to people saying negative things about your preparation or the exam, or people are ranting online. Don't care. Go to your prep. I am thankful that my circle mein everybody is like, okay, you will do it, and all of the us are from different streams, and we all helped each other in a way. They kept my sanity in place. Honestly, I used to meet them. I used to laugh with them. आधा घंटा ही सही, half an hour, 45 minutes. I used to go out with them. I used to have random conversation. We used to talk and we had shared our experiences. They used to ask me about patients, and वहीं से we generated a bond about कि medicine का उनको भी interest आने लग गया. And they are non-medical people, non-medical students, and they have a fair idea with me, sitting with me, and I did not care about anything else in that 45 minutes, 30 minutes or 45 minutes. I used to enjoy my life. Do not forget why you are doing this. It is one of the most integral part. FMGE जो होता है यहाँ पे, you are already doing the whole 19 subjects once, and आगे जो भी exam you have to give, it is a stepping stone for that. And people have undue hate to FMGs. It doesn't matter. They are not writing the exam. They are not giving the exam for you. Don't care. Shut your ears to those things and just go on. Keep going. Whenever you feel low, my DMs are open. Text me. I am ready to talk about anything you want. And focus on yourself for the next 6 months. Okay, don't just be कि ये exam इतना tough है. Stop this nonsense कि exam इतना tough है and this gets so difficult. Please stop that. Go on, give your time, give your best, and उसके बाद तो you have your internship waiting for you on the other side. But ये एग्जाम है डिफिकल्ट. डोंट बी इन द अजम्पशन, क्योंकि बहुत सारे मैंने आई हैव सीन पीपल सेइंग ओके एफएमजी के लिए इतना इनफ है, एंड एफएमजी वाज द एग्जाम जहाँ पे पहली बार वीडियो क्वेश्चंस आ गए एंड एवरीथिंग चेंज्ड इन द एग्जाम हॉल. एंड द फर्स्ट पेपर वाज सो ब्यूटीफुल, सो अमेजिंग. सेकंड पेपर से जो वीडियो क्वेश्चन स्टार्ट हो गए ना, फर्स्ट में भी थे बट सेकंड क्वेश्चन से जो सेकंड वाले से जो स्टार्ट हो गए ना, एवरीबडी केम टू देयर सेंसेस कि इट इज नॉट एन एग्जाम, इट इज अ स्क्रीनिंग एग्जाम. इट इज गोइंग टू स्क्रीन यू फॉर थिंग्स. इट इज एन एबिलिटी एग्जाम ऑल्सो. It is the only concession there is you have to score 50% and you don't have to score more to get somewhere. You have to, for passing you need 150. Okay, fine, but the ability to 150 is not easy. So focus on it, give your best, and just sit with people who are motivating. If they are being irritating and they are demotivating you, skip them. Don't meet them. Don't meet such people. Don't talk to such people. Tell your parents, don't talk to me. Don't bring me stupid news कि ये चल रहा है वो चल रहा है FMG को लेके. Don't care. If your paper is changing the date, तब जाके it is your problem. If it is not, then don't care. Okay, so special thank you to my friends as well. And this is my YouTube channel, Medicine Rewired. I've just started on, and I'm going to be sharing all the things that I have concised and the concise things that I was discussing with you. यहाँ पे I'll share everything. Medicine Rewired Instagram handle is also there, and this is my email. And the thing that I showed you for respiratory medicine, that was just an example. I have done it for all my systems. I have all the notes, digital copies I have, physical copies I have. So anybody, if you want anything, this is my page, and reach out to me if anything related to exam, outside the exams, anything. I'm available, always there. And respect your colleagues, please. Don't think कि कोई तुमसे कम पढ़ रहा है या तुमसे ज्यादा पढ़ रहा है तो वो अलग इंसान है. No, absolutely not. I am here. Thank you. My name is Dr. Kazi, Dr. Yahya Kazi, and I'll always be available for you. Thank you so much.